there are a lot of funny experience, but you just have to take your time. Know that the client you have met or the person that came has a problem. Pharmacy outlet is not a restaurant. It's not amusement park. So the first thing you should understand is any person that comes into your premises has a need to be met. And nobody's happy parting with money to buy drugs. So you just have to hold your own end and explain. No matter how funny or how stupid the question may be, you just have to do your proper counseling.
I mean, in these two stories that you have told us, you just buttressed the value of pharmacists in the community. You know, we are in an environment where patient education is taken for granted, especially in low-income areas. You know, there is little or no health education to patients. And so the presence of community pharmacists there and the presence of community pharmacists there providing pharmaceutical care becomes their only access to credible health education. And that way, saving, you know, lives. Unfortunately, we do not have data to be able to quantify the number of lives saved, untoward events prevented by pharmacist intervention. And maybe that is something that, you know, probably individually in community pharmacies, pharmacists can begin to do, to record untoward events where their intervention made a difference, either increase the quality of life of the patient or overall prevention of death. Very pretty important. I think that's very thin line would help people understand much more the value that the community pharmacy may just be in one space, one little space,
corner.
One corner, but it is invaluable what that premise is doing for that environment. You have 7 premises around the city of Abuja, and cannot just begin to quantify in your 15 years of practice how many lives have been changed, you know, and how many lives have been affected positively, how many people have had their quality of life improved just because you decided to study pharmacy. So we are celebrating you,
Thank you, ma'am. We cannot really overemphasize that the pharmacist is not adequately being remunerated for the services he renders. But the passion keeps on going because there is nothing satisfying like somebody stopping by, say, "Fam, thank you, the drug worked." Right? This internal joy that it gives. Or you see somebody that when the person entered your premises is shivering, shaking, can barely walk. And within, let's say, 48 hours, you see the person passing by, even if you didn't stop by, but you knowing that the person is okay.
Okay.
Yes, that is also gratifying. So
it's like
we believe
you are
that
answering the very last question already, just talking about these things. I was going to ask you, what do you love the most about being a pharmacist? So maybe you can just go right into that.
Okay, well, with respect to that, I would say providing solution, medical solution to my clients. Just like I was explaining earlier on, see somebody that could barely talk, smiling and full of life, that is back to life because of your intervention, and also preventing both disease and death by offering the right counseling, medical advice. So those are the things that we love as pharmacists. And also reducing poverty by creating employment for my teaming staff, and God helping me or helping us, making their remuneration better, so that they have that zeal.
Your staff will be on this live. They are watching you and hearing you, sir. Probably will.
Yes, somebody made a comment. I saw the name.
Yes.
One Lazarus Agwom, that's my pharmacist. Uh,
That's beautiful.
I saw the name, so I was surprised that it's also online.
Yes. Amazing. Thank you so much. Thank
My
you so much,
pleasure.
Pharmacist, for joining us this afternoon to celebrate the World Pharmacist Day with us, just as an extension, part of the World's Pharmacist Day celebration. We would like to launch the Shelf Life and Nigerian Pharmacists group on Facebook, where we will be, sharing a lot of educational, educational, um, educational links, educational resource to help us better our practice. We'll also be sharing the things that we are doing that pharmacists can be part and parcel of. I earlier mentioned about the mother and child nutrition health program that we are a part of, the supply chain and distribution for that program. And we've been at the forefront of prevention of postpartum hemorrhage, promoting safe motherhood. We believe that there is a part pharmacists will play, and so that group has been created. If you are on this live, this is your cue to join the group. It is in the comment section. It will be put on the comment section by one of us, one of the members of the team, so that we can click and join. You'll be admitted, and then you begin to see some really beautiful results to help us update our knowledge of healthcare and pharmaceutical care. We're grateful. Okay. We're hoping to be able to partner with you much more, partner with Morning Sun much more in the coming days to expand more and reach more people in Abuja. And probably you'll be thinking of, going beyond Abuja and going to other cities in Nigeria.
Outside Abuja too. We are in Akwa Ibom.
Oh, beautiful, beautiful. Yeah. That's amazing. So as we are expanding into other cities, so we need to talk about your premise in Akwa Ibom, sir, because we're also in Akwa Ibom.
Okay.
But we'll take it out of here. The other cities that we are coming very quickly to, and we hope to continue to partner with you for growth and access. Thank you so much for joining us this morning. We appreciate you. Thank you, everyone, for joining us.
It's my pleasure. But when you want to write that book, remember to reference me.
No, you're the one who is writing the book, sir. No, okay. It's your book. But if you want me to write it, we can talk, out of camera, outside here, and do a shelf life collaboration, for young pharmacists. I think it will be a beautiful idea. Something we can take out of here.
You actually need a guide.
Yes, exactly. I agree with you 100%. Thank you so much, sir. Have a beautiful day. Thank you, everyone.
You too. Bye.